Welcome. Welcome to the Makarasana pose, the crocodile pose. The crocodile pose, for those that don't know, is a pose for learning how to breathe diaphragmatically. Learning how to breathe diaphragmatically means you'll get more oxygen in your system. To get into this pose, lie down on your belly. Spread the legs and the extended legs comfortably apart with your toes pointed outward if you can. If you can't, then you'll put something under your ankles and you can slightly turn them out. So if you can, slightly lift your pelvis and rotate your thigh muscles towards the outside so that you broaden the opening in the front. Perfect. If you can't do this pose, then you can put your feet together easily enough, or if you need more support, you can add more support. So this is for those of you who have lots of pain in the feet and you want to relieve the toes and the ankles. And the head and neck, if you have neck pain, back pain, anything in the spine, you'll want to elevate yourself slightly up so that you're supported. This is mostly the supported Makarasana, and you'll find this very comfortable once you get yourself in the position. Your arms are crossed so that your right arm is over the left arm, and your lower ribs are touching the floor. Technically, without the blanket, only your lower ribs would be touching and their forehead would be touching. So that would be an opening underneath that. So if you don't have any pain in the upper spine, in the shoulders, or in the hands, this would be the alternate. You can do that and find it comfortable. It takes maybe a few minutes to get into this pose. And the whole purpose of this pose is so that you learn to find the breath, lower into the lungs and into the diaphragm. So it avoids breathing higher up in the upper lungs, as we sometimes do when we're in a fight and flight phase, which if there's any anxiety in your life, you'll notice that. You'll be upper chest breathing more often. And this allows your breath to move downward. So as you now concentrate on the breath, allow your breath to move into the nostrils, just in and out. Allow the breath to move in and out. Observe the flow of the breath. And while exhaling, observe the stomach and the navel area contracting, moving inward. While inhaling, observe the stomach and the navel area expanding, moving outward. Do you observe any movement in the chest? Allow the breath now to become, or let your breath become, or allow your breath to flow freely. without a pause, deeper, smoother, and without noise. No pauses. Going deep into the breath, quiet breath. Make it smooth, without a noise. No noises, no pauses, no breaks. Gently feel the contraction, expansion of the stomach and the navel area. Observe the flaring of the lower ribs out to the side. Observe the gentle expansion of the mid back and lower back. Feeling a nice massage of your sacral area. These are the qualities of a 3D breathing. Avoid doing this pose if you're pregnant or if you have a heart condition. Or if you have a severe scoliosis, don't do this more than 2 or 3 minutes at a time. And if you have severe depression, this would be not the optimal time for you to do it until you've had a strong exercise. You can do this pose 20 minutes optimally. You can certainly come out of this earlier if you like. But 20 minutes seems to be about the time that the brain needs to begin to come into a quiet place. And maybe you have noticed already that there's a quieting of the mind. It's very easy in this pose to notice your mind and observe the mind. And it's very helpful for your muscles to relax. Just let go of those observations in the mind and let them move on and come back to the focus on the breath. The breath helps you to relax, and you can follow the breath from the nose to the navel area, and from the navel area to the nose. This gives the mind something to do and to relax. Allowing the mind to relax more, allowing the muscles to relax more. Just feel the depth of that relaxation. Just a simple observation of the breath will bring you back into the body and quiet the mind. It's not been quite 20 minutes yet, but I'd like to show you how to come out of this pose. Feel free to stay and review this video if you like. And for the moment, the way to come out of this pose is to release the arms, extend the arms above the head, and let your cheek turn to one side. And let your arms, your elbows bend a little bit so that you have, well, just not quite that much, just a little bit less, just so you have a little circle around your head. Yeah, like that. And bend the knees. And then roll over onto your left side with your arm extended. And take a few deep breaths before you come up. Just notice, never lose the consciousness of the breath you created earlier. Stay in that consciousness, stay in that breath while you're coming up to a sitting position. And then seat yourself on your seat. Let your eyes be relaxed and closed. Take a few more deep breaths into the abdomen. Notice that where your breathing has shifted to and how much longer your breaths are. Namaste.